Hello, my name is Stephanie and today I will be performing the oxygen administration skills video. I've entered my patient room. I've closed the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, Mrs. Garcia. My name is Stephanie and I will be your nurse today. Can I please have you verify your first name, last name, and date of birth? Thank you so much for that. So your oxygen is a little low today. Your doctor has prescribed a nasal cannula to help you breathe better. I will take the nasal cannula from the wrapping, throw that away. I will take the nasal cannula tubing, plug it into the oxygen flow meter here in the right on the wall, and normally that should be between 1 to 6 liters per minute. The doctor has prescribed an order to set the rate at 3 liters per minute. I will take the prongs and apply them here to your nostrils, and this will sit around your ears. I will go ahead and make sure that this is nice and tight. How do you feel? All right, sounds good. If you have any discomfort or pain, please let me know. And I will go ahead and document my procedure on my computer. And please let me know if you have any discomfort. Again, the call light is here within reach. Let me know if you have any questions. I will perform hand hygiene, close the door behind me. I walk back into the room and perform hand hygiene, close the door behind me to ensure patient privacy. Mrs. Garcia, so the oxygen is still a bit low. So the doctor has ordered a non-rebreather mask to help you breathe better, okay? I'm going to go ahead and disconnect the tubing here for the nasal cannula. Remove the nasal cannula. I will go ahead and toss this in the trash. I will take my non-rebreather mask. I will take the tubing from the non-rebreather mask, connect it to the wall here to the oxygen flow meter. That rate should be around 12 to 15 liters per minute. Per the doctor's order, we're going to go ahead and set it to 13 liters per minute. I will go ahead and apply the mask over the nose and wrap around the patient's head. At this point, we should start hearing some oxygen flowing here. All right, Mrs. Garcia, so I will take gauze pads, apply those between your ears and the straps to ensure skin integrity. I will be checking for skin integrity every 4 hours at a minimum to ensure there's no breakage or irritation. I will cinch the metal belt here in the skin to make sure that the oxygen flows properly. All right, Mrs. Garcia, so if you have any pain or if you have any symptoms, any shortness of breath, any pain, I will be checking in on you. Please go ahead and ring the call light there that's within reach. I will go ahead and walk out and document my procedure if you don't have any other questions. All right, sounds good. So I will perform hand hygiene, exit the room, close the door behind me to ensure patient privacy. All right, so I walk back into the room, close the door behind me to ensure patient privacy, perform hand hygiene. All right, Mrs. Garcia, so your oxygen is back to normal and the doctor has put it in order for me to remove your mask. All right, so I will go ahead and remove the gauze pads. I will turn off the flow meter here on the street, on the wall here. I will remove your mask and discard the mask. All right, Mrs. Garcia, so are you comfortable? Is there anything else I can do for you? Everything's good? Okay, so the call light is there next to you within reach. Please do let me know if you have any questions. And I will go ahead and document the procedure in your chart, exit the room, perform hand hygiene, and go document the procedure.